What if another pandemic as bad as COVID-19 soon strikes us? Isn't it a scary thought that sends shivers down our spines and sparks a frenzy of introspection? Pandemics like the COVID-19 pandemic, the H1N1 swine flu pandemic, and the Spanish flu in 1918 all had terrible consequences on society. The value of being ready and taking preventative action to stop the spread of infectious illnesses with the risk of every new epidemic. This video will examine the potential risk posed by two emerging viral diseases worldwide, the avian flu and the SEERS, severe epidemic Enterovirus respiratory syndrome. We will determine how we can prepare ourselves before another pandemic hits us. Avian flu, the recent spread in the USA. The avian influenza virus, also known as the bird flu or avian flu, mainly affects birds. In the USA and other countries worldwide, there have been rare instances and outbreaks of avian flu in recent years. However, concerns have been raised because some bird flu strains such as H5N1 and H7N9 tend to infect humans and cause significant illness, spread of virus. Humans are only at a low risk of contracting the disease through proximity to diseased birds or settings for an extended period. Direct contact with infected birds or their droppings is a major method of disseminating the avian flu. Infected surfaces, tools, and airborne particles can also spread the infection. Symptoms: fever, coughing, lethargy, headaches, muscular aches, and red eyes are among the symptoms. Worries are raised by this virus's ongoing development and the potential for persistent human-to-human transmission. Today's linked globe makes it more likely that a localized epidemic can swiftly spread to become a pandemic, as with COVID-19. SEERS, the impending threat. SEERS, an acronym that sends a shiver down the spine of experts and visionaries alike, represents a big threat on the horizon. Severe epidemic Enterovirus respiratory syndrome, though hypothetical at present, has captured the scientific community's attention as a potential catalyst for a future pandemic, with concerns growing that its impact could be felt as early as 2025. Belonging to the Enterovirus family, known for unleashing a barrage of respiratory infections, SEERS emerges as a specter of uncertainty, weaving its way through the fabric of our imaginations. While the exact characteristics and mode of transportation of SEERS remain elusive, experts anticipate that this viral chameleon can rapidly spread from person to person, triggering a devastating respiratory syndrome reminiscent of the darkest chapters in our history. Drawing upon the lessons learned from previous pandemics, scientists and researchers remain on high alert, meticulously piecing together the puzzle of SEERS. Preparing for a new pandemic. It is essential to draw lessons from the previous pandemics and take proactive steps to guarantee readiness given the possible hazards posed by avian flu and SEERS. Here are some crucial actions to take into account. 1. Stockpiling essential supplies. Stockpiling essential supplies is another crucial aspect of pandemic preparedness. Building and maintaining adequate reserves of essential items can help mitigate the impact of a pandemic and ensure the availability of vital resources during times of crisis. Here are some key considerations for stockpiling critical supplies. Medical supplies. Stockpiling medical supplies is of utmost importance during a pandemic. We saw how during the COVID-19 pandemic, medical supplies went out of stock quickly. There should always be a good stock of personal protective equipment, masks, gloves, goggles, and gowns for healthcare workers and the general public. Pharmaceuticals. It helps ensure continuous access to necessary treatments and prevent shortages in healthcare settings. Adequate reserves of essential medicines, including antiviral drugs, antibiotics, and other necessary medications, should be maintained. Emergency equipment. Stockpiling equipment such as generators, fuel, communication devices, and backup power sources can help maintain essential services during a pandemic. It includes ensuring the functionality of critical infrastructure, such as hospitals, healthcare facilities, and emergency response systems. Besides medical supplies, keeping enough stockpile of food and water is also essential. 2. Promoting public health education. A key component of pandemic preparedness is promoting public health education. People can proactively safeguard themselves and others by making informed judgments and spreading correct information. Informing the public about pandemics, their transmission patterns, and the available prophylactic measures requires effective communication initiatives. Concise and clear messages may be communicated to audiences via various media, such as radio, television, social media, and community participation programs. These messages stress the value of behaviors such as routine hand washing, good respiratory manners, and the use of personal protective equipment. The importance of immunization, routine health exams, and following instructions from healthcare officials are also emphasized in public health education. Public health education equips people to actively participate in halting the spread of illness and lessening the effects of upcoming pandemics by fostering a culture of hygiene and responsible conduct. 3. Implementing social distancing and hygiene measures. Implementing social distancing and hygiene measures is a crucial component of pandemic preparedness. These measures help reduce the transmission of infectious diseases, including respiratory viruses, and minimize the impact of a pandemic. Here is what needs to be done. Slowing the spread of the virus. Social distancing measures, such as maintaining physical distance from others, avoiding large gatherings, and limiting non-essential travel, reduce the virus transmission rate. By minimizing close contact between individuals, the spread of the virus can be slowed, reducing the burden on healthcare systems and allowing time to develop effective medical interventions. Preventing overwhelm of healthcare systems. Implementing social distancing measures helps prevent a rapid surge in infections, which can overwhelm healthcare systems. Physical distance can assist in flattening the curve by reducing the frequency of severe cases necessitating hospitalization over a longer time, ensuring that medical resources and staff can adequately address patient requirements. Protecting elderlies and children. Social isolation policies are crucial for safeguarding vulnerable people, such as children, the elderly with medical illnesses, and people with weakened immune systems. By keeping a safe physical distance from each other, they can lessen their chance of contracting the virus and developing life-threatening conditions. Adapting to changing circumstances. Social distance and hygiene measures can be customized and altered based on the changing situation and advice from public health authorities. Maintaining a balanced approach to pandemic management requires adaptability and the preparedness to enact tighter regulations or ease restrictions as necessary. Good health hygiene practices. Promoting good hygiene can help stop the virus from spreading by encouraging people to wash their hands often with soap and water, use hand sanitizers often to remove germs, and avoid touching their faces. Covering the mouth and nose with a tissue or elbow when coughing or sneezing assists in stopping the discharge of respiratory droplets harboring the virus into the atmosphere. 4. Enhancing international cooperation. As a crucial foundation for a unified global outbreak response, international cooperation is vital in pandemic preparedness. Firstly, international cooperation facilitates early warning and information sharing. Countries can detect outbreaks promptly and respond swiftly by collaborating and exchanging epidemiological data, surveillance findings, and research insights. Timely information enables the implementation of preventative measures to contain the spread of diseases across borders. Secondly, cooperation allows for resource sharing and capacity building. Countries with advanced healthcare systems can support those with limited capacities by providing essential resources, expertise, and training. This collaboration helps strengthen healthcare infrastructures, enhance preparedness and response capabilities, and ensure equitable access to healthcare services during a pandemic. Lastly, collaborative research and development efforts are accelerated through international cooperation. Joint research projects promote a comprehensive understanding of emerging viruses and aid in developing effective countermeasures. Countries can collaborate on developing vaccines, diagnostic tools, and treatments by sharing scientific knowledge, data, and research findings. 5. Investing in telemedicine and digital health solutions. Investing in telemedicine and digital health solutions is crucial in pandemic preparedness. These technologies offer innovative ways to deliver healthcare services remotely, ensuring access to medical care while minimizing the risk of transmission during a pandemic. Telemedicine provides increased access to healthcare, especially in areas with limited medical facilities. Utilizing virtual platforms allows individuals to consult with healthcare professionals, regardless of location. This eliminates barriers to access and improves healthcare availability, particularly when in-person visits are challenging or restricted. Virtual healthcare through telemedicine offers great benefits, such as limiting disease transmission. With no direct physical interaction, this approach reduces the spread of contagious diseases. Patients can conveniently get medical advice, consultations, and follow-ups without risking themselves or healthcare providers to potential infection in waiting rooms or healthcare facilities. The threats posed by avian flu and the potential future pandemic of SEERS underline the need for preparedness and proactive measures. To achieve a safer and healthier future, we must incorporate lessons from previous instances, reinforce observation setups, fund inquisitive studies, educate the general public, and amplify healthcare methods. The significance of preventing and reacting quickly to diminish the repercussions of pandemics and protect communal well-being is vital. Let's join hands and strive for a better tomorrow.